Did you know a viral disease was understood and founded back in 1976? It was named after the Ebola river in DRC, and it was wreaking havoc because there was no vaccine, no treatment. But the problem here is when we are talking about the present time 2026, it is the same Ebola virus disease which is on an outbreak, which still has no vaccine, and there are no particular treatments out there. And that is why WHO had to go ahead and declare Ebola virus outbreak as a public health emergency of international concern. Hello everyone. Welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh, and in today's session we are going to talk about Ebola virus. We are going to understand that why WHO had to label it as public health emergency of international concern, what are the criteria which are considered for this particular label, what exactly is this Ebola virus, how often have the outbreak been happening, and everything that has gone beyond it. So let us begin with understanding the current situation, that what exactly has happened. So as of now, if we look at the spread of Ebola virus, it is present across Uganda. Uganda's specific regions are also seen, such as we have Ituri province, then we have Kinshasa, then we also have the spread across another country, that is Uganda. So two countries as of now are seeing the full-fledged outbreak, that is DRC and Uganda, and that is why WHO has declared this Ebola outbreak as a public health emergency of international concerns. As of now, there are 80 suspected deaths, 8 confirmed cases and 246 suspected cases in line. Now the problem here is when we are talking about this situation, why this becomes serious as of now, because we have started to see the cross-border spread of this particular virus. It has been detected. That means when we are talking about containment of the virus in a certain region, that might go out of hand. Another big problem that makes it very serious as of now is the high fatality risks which are present. So when we are talking about the mortality which is possible because of Ebola virus, that is on the higher end. Third factor that makes it very serious is the fact that health workers, especially in these regions, have already been infected. So that means we are looking at a situation where the healthcare system might be infected and might not be able to help the situation. We are looking at a situation where the transmission cannot be controlled to a given region, and most importantly, there is no approved vaccine which is present. Now to worsen this situation, we have another factor that we need to consider, that as of now this particular outbreaks involves Bundibugyo strain. Now we already are aware that we do not have a vaccine for this, but another problem with this strain is that a specific antiviral treatment is also not available. So lack of approved vaccine and a specific antiviral treatment makes this strain further more deadly and raises the fatality risk which we are seeing in this particular Ebola outbreak. Now that we have understood that what the situation looks like, let us move to understand that what exactly has led to this situation, what exactly is this Ebola virus disease that we are talking about. When we are talking about Ebola, the name, as I mentioned, is taken from a river in DRC, and it is a virus which is known for targeting the blood vessels. Now it is this targeting of the blood vessels which leads to severe internal as well as external bleeding. It was first identified in 1976, and this outbreak, since it has been found, has unfortunately killed at least more than 15,000 people. Now based on WHO's understanding, it is responsible coming from fruit bats. So fruit bats are the natural hosts of Ebola virus. Ebola virus is present in them, and it is suspected the spillover is coming from fruit bats to humans. Furthermore, it has been clarified that the contact through bat saliva and droppings can also infect other animals, and the transmission can take place. The transmission can happen through consumption of wild meat as well, or touching the objects that have been contaminated. Now, when we are talking about Ebola virus disease, we have to understand that it is a severe viral hemorrhagic fever which leads to bleeding, and it is often fatal in humans. The fatality rate is above 50% in this scenario. It is a zoonotic disease. I think we have established this from the fact that the transmission starts from animal and then it comes to human. There are multiple ways in which transmission can take place. Now, the nature of disease is such that the transmission is not only from animal to humans, it can easily happen from human to human through any bodily fluid which is present. So, in this context, the spread becomes really fast. Even though primary hosts are limited, but the spread from one human to another goes at a rapid rate. And as I said, the fatality rate here is very high, and based on the strains, it can range from 50%, it can go towards 25%, it can go towards 90% as well, making this very virus disease very scary. It starts with showing basic symptoms like fever, vomiting, and gradually moves towards damaging the functional cells of the liver, lining of blood vessels, blood cells which are absorbing foreign particles, and then definitely it becomes fatal as well. So, in this context, I think now we are clear that how exactly Ebola virus disease has come upon, what are the transmission and what are the symptoms that are usually seen. Now, let us move to understand that in this context, when we are talking about this disease was found back in 1976, and I also briefly mentioned, as of now we can see that more than 15,000 deaths in Africa itself have been caused by this particular virus. How this has happened over the years. Now, Ebola outbreaks have been something very frequent, especially in the African continent. Now, you have to connect it with the primary host presence of fruit bat. But when we are talking about the effect, we can clearly see that especially the one in 2013-16 has been the deadliest outbreak. And the reason we see continuous outbreaks is because of the fact that as of now, even till date, we do not have presence of any vaccine which can control this. When we are talking about 2013-16 itself, when the outbreak happened in West Africa, we had more than 280,000 cases and 11,000 deaths. And there was a time when we saw the spread of this viral disease, not just in Africa, it went towards Europe as well as USA. And given the fatality, given the risk associated with disease, when we are talking about WHO labeling it as public health emergency of international concern, it is something important. Because when you look at the clarification or the statement that has been given by WHO chief, it says that as of now we cannot declare it as a pandemic, but PHEIC is something that it duly deserves to be labeled as. So, there is a possibility that this might become a pandemic. Outbreak, now public health emergency of international concern, and maybe a pandemic as well. But when we are talking about PHEIC, it is a highest global health alert that exists, especially when we are talking about WHO. It is declared only when the disease is starting to spread internationally, and that is why a coordinated global response is required. So, that is when WHO declares PHEIC and a global coordinated response is seen. Now, in the current situation when we are talking about, it is meeting all the required criteria. For example, cross-border transmission. It has already moved from DRC to Uganda. Then urban risk is also present. We are seeing cases in Kinshasa, Kampala already. The scale is not determined as of now, it remains uncertain. So, large number of unexplained deaths. The number is somewhere around 80. The confirmed cases as of now are only 8. Suspected cases are around 246. And there is also a huge possibility that there is underreporting. Amidst this, we are also seeing that health worker deaths is also happening. So, infection prevention gaps are visibly present. And to worsen the scenario, as I have mentioned multiple times across this session, that there is no vaccine present. Whichever existing Ebola vaccine are present, they only target a particular type of strain, that is the Zaire strain. Zaire is again a river which is found in Africa. Can you tell me in which country this river is found? Now, given that Ebola outbreak was meeting all the given criteria to be labelled as a public health emergency of international concern, WHO has rightly done so, and if need arises in the coming time, it might be also labelled as a pandemic. But the challenges around this viral disease remain persistent because this outbreak is very difficult to contain. When we are talking about countries in which the spread is seen as of now, they are major conflict zone, especially when we are talking about Eastern Democratic Republic of Congo. Apart from that, when we are talking about healthcare and the infrastructure, these are one of the least developed countries across the world. So the health infrastructure is also immensely weak. And when we are looking at weak healthcare infrastructure and delayed response, that leads to difficult containment. Furthermore, when we are talking about the population that can be impacted, there is a lot of mobility which is present. High population mobility means there is a possible of targeting of as many people who are present there. And to add to that, because we know the healthcare infrastructure is limited testing, limited addressal, and above all that, the lack of government funds, government infrastructure, community mistrust, all of this shows that it is a very difficult situation to resolve as of now. Furthermore, the challenges are not only in terms of infrastructure. We have already understood the vaccine challenge and how immense it is. This is something that requires years and years of research and development. Given that the present strain has no approved vaccine, makes it further difficult. And this is where the recommendation of WHO comes into the picture, where they are talking about strengthened surveillance, they are talking about contact tracing, isolation facilities, safe burials, and community engagement. But all of this lacks relevance. If the incidence of cases increases, this might turn into another scenario that we have seen unfortunately in 2020 in form of COVID-19 pandemic. So this Ebola outbreak is yet another reminder of how fragile humans are, how important it is to strengthen the healthcare infrastructures, how fastly there is spread of zoonotic disease, and also that this is where the techno fix or innovation fix or R&D fix is very much required. I hope you have a fair clarity on the topic. If you have any doubts, let me know in the comment section. I'll be leaving you here with a prelims practice question. Let me know the answer to this in the comment section. That was all from my side. Thank you so much.